Gum disease, if untreated, always ends the same way: tooth loss. We lose teeth because the bone around our teeth gets destroyed, and eventually they will get loose and they will fall out. Gum disease is one of the most chronic conditions all around the world, and it's something that I see every day as a dentist. Nobody wants to lose all of their teeth, so is there a way that we can actually undo the effects of gum disease and bone loss? And what are the best ways to actually stop this from happening in the first place? Let's dive into the topic of bone loss and gum disease, and where's the best place to start? Gum disease is a chronic inflammatory condition that is mainly caused by bacteria that live in that sticky biofilm that we've all heard of, plaque. But it's not just plaque that causes gum disease. There are loads of different risk factors, and these can range from things like smoking and your genetics to other medical conditions like diabetes. And then everything in between, like if your teeth are crowded or crooked, then they can be more difficult to clean, but also more prone to getting a buildup of plaque. Now, gum disease doesn't happen all at once. It happens over the course of months and years, but very early gum disease, or gingivitis, is inflammation that is only confined to the tops of the gums. And over time, this inflammation will start to affect other structures around the teeth. And eventually, and if this inflammation stays there for long enough, then the bone around the teeth will start to get damaged, break down, and dissolve away. If too much bone is lost, then the teeth will start to get wobbly and eventually they're going to fall out. Okay, so what's the big deal? I'll just go and get my teeth cleaned at the dentist and it'll all go back to normal, right? No. So if you have gingivitis, then yes, that's entirely reversible. However, if it goes beyond that and if the bone starts to get damaged and lost, then unfortunately, that's irreversible. And the scary part about this disease can really start to become self-perpetuating. And this happens because when the bone is lost, it creates this pocket around the teeth, and those bacteria that cause gum disease in the first place can get into those pockets, and that can cause the gum disease to start to progress even further. And this is why it's so important to keep on top of those professional cleanings that your dentist or hygienist does. And this is why sometimes they may even recommend those deeper cleanings, because those deeper cleanings will get into those pockets and eliminate all of those bacteria. So is there really nothing that you can do? Well, there are some very advanced and quite complex procedures, and these are called guided tissue regeneration. And these would really only be done by a specialist. This allows stronger tissues to heal in place of those pockets that we were talking about earlier, which if you combine that with a bone graft, then that could allow bone to regenerate there. Now, there is quite a lot that goes into those procedures, and that's quite a simplified explanation of what happens. But if that is something that you are thinking about or think that you might need, then I would definitely go and speak to your dentist, but also maybe think about going to see a periodontist. But more broadly than that, there are much simpler things that you can do, mainly prevention. Mainly this comes down to having good hygiene, good brushing, good flossing, regular dental visits to keep on top of your gums, but also managing other risk factors. So if you smoke, I would consider giving up smoking. Make sure you have other systemic conditions under control if you suffer from diabetes. There's other things like genetics as well that can play into that, but it's not so much of something that you can really control. If you find that video useful, don't forget to subscribe and like this video, and maybe think about watching this video next.